Today's topic for presentation is oral manifestations of HIV. HIV is a global health problem. In 1981, it was identified as an opportunistic infection in homosexuals. Luc Montagnier in 1983 isolated the virus. The International Committee on Taxonomy of Virus gave the term HIV. India HIV estimation 2023 reports that 2.5 million people are affected with HIV, and there is an annual new HIV infection of 66,400 in India. Coming to the oral manifestations of HIV, the EC Clearinghouse classification classifies HIV as Group 1, Group 2 and Group 3. Group 1 is lesions strongly associated with HIV. Group 2, lesions less commonly associated with HIV. Group 3, lesions seen in HIV. In Group 1 lesions strongly associated with HIV, the lesions are candidiasis, hairy leukoplakia, Kaposi sarcoma, non-Hodgkin's lymphoma, and periodontal diseases, linear gingival erythema, necrotizing ulcerative gingivitis, and necrotizing ulcerative periodontitis. Lesions less commonly associated with HIV are bacterial infections, Mycobacterium tuberculosis and Mycobacterium avium, melanotic hyperpigmentation, necrotizing ulcerative stomatitis, salivary gland diseases, xerostomia and salivary gland swelling, thrombocytopenic purpura, non-specific ulcers, and viral infections, herpes simplex, varicella zoster virus, and human papilloma virus infections. Lesions seen in HIV, bacterial infections, Actinomyces israeli, E. coli, Klebsiella pneumonia, cat scratch disease, drug reactions like ulcerative lesions, erythema multiforme, lichenoid reactions, and toxic epidermal necrolysis. Epithelioid angiomatosis. Deep fungal infections include histoplasma and mucormycosis. Neurological manifestations include facial palsy and trigeminal neuralgia, and viral infections, cytomegalovirus and molluscum contagiosum. We'll see the lesions in detail, that is lesions strongly associated with HIV, the group 1 lesions. Candidiasis is used as a clinical marker to define the severity of HIV. The types of candidiasis presented in HIV patients are pseudomembranous, erythematous, hypoplastic and angular cheilitis. It is treated by topical and systemic antifungals. Topical being nystatin 1 tab 5 times daily. You have to dissolve the tablet in the oral cavity, swish and spit out. Then clotrimazole, it's available as gel, that is 5 ml 3 to 4 times daily for 2 weeks. The systemic medications are fluconazole 150 mg once daily for 2 weeks and itraconazole 100 mg once daily for 2 weeks. These are the various manifestations of HIV affected patients with candidiasis, that is pseudomembranous candidiasis, then atrophic candidiasis, which is seen in the midline of the dorsum of the tongue, angular cheilitis, and hyperplastic candidiasis. Hairy leukoplakia is an early marker of immune suppression. It is seen in HIV patients, but the etiology is Epstein-Barr virus, and common site is lateral border of the tongue, and it presents as faint white vertical streaks. It can be treated with acyclovir 800 mg 4 times daily for a period of 2 weeks. Kaposi sarcoma is the most common AIDS-associated malignancy. The etiology is human herpes virus HHV8, and common sites are palate and the gingiva. The lesion appears as red to purple macules, papules or nodules or ulcerations. The treatment is surgical excision, cytotoxic chemotherapy and local radiation. Non-Hodgkin's lymphoma is an AIDS-defining condition. It is associated with severe immune suppression, and site is commonly seen in the palate, gingiva and the alveolar mucosa. Clinically, it appears as soft tissue masses, ulceration and tissue necrosis. It can be treated with radiotherapy, chemotherapy, that is bleomycin and vincristine are the chemotherapeutic agents. Periodontal diseases, linear gingival erythema, it presents as a red band along the anterior gingival margin. It can be treated with scaling and chlorhexidine gluconate mouth rinse can be given. Necrotizing ulcerative gingivitis. It affects interdental papilla, but there will be no loss of periodontal attachment. Necrotizing ulcerative periodontitis is a rapidly progressing non-healing periodontal disease characterized by loss of periodontal attachment, exposed bone, and there will be severe immune suppression with CD4 counts less than 100 cells per millimeter cube. Treatment: local debridement, scaling and root planing, and irrigation with chlorhexidine and povidone-iodine, metronidazole 400 mg to start with, followed by 200 mg 4 times daily. The second group of lesions are lesions less commonly associated with HIV. Melanotic hyperpigmentation is an early sign of adrenal insufficiency, and it can also be seen as a secondary manifestation to medications taken by the HIV patients. Necrotizing ulcerative stomatitis. It is an acute painful ulcerative lesion, and there will be necrosis of the tissue and exposure of the bone, and it is characterized by severe immune suppression with CD4 cell count less than 100 cells per millimeter cube, and it is treated by local and systemic steroids, antibiotics and soft tissue stent. HIV salivary gland disease, xerostomia. It can be a side effect of the drugs taken by the HIV patients, or you can see enlargement of the salivary glands. It is a parotid gland enlargement which can be unilateral or bilateral. Treatment is symptomatic treatment. You can also give artificial saliva, then pilocarpine and bethnacol can also be given. Thrombocytopenic purpura is a hematological manifestation of HIV characterized by petechiae, ecchymosis, spontaneous gingival bleeding. Non-specific ulcers, ulcers more than 2 cm in diameter with irregular borders with no definite etiology. Herpes simplex virus. Here the CD4 cell count will be less than 50 cells per millimeter cube, and acyclovir 200 mg 5 times daily is a treatment for herpes simplex infection. Human papilloma virus infection presents as oral squamous papilloma, verruca vulgaris, which is a common wart, focal epithelial hyperplasia or HEX disease, and condyloma acuminatum. It is treated by surgical removal, laser surgery, cryotherapy, application of podophyllene resin, and antiviral agents. Herpes zoster presents as unilateral vesicles, and the treatment is acyclovir 800 mg 5 times daily. Complication is post-herpetic neuralgia. The group 3 lesions are lesions seen in HIV. Bacterial infections: Actinomyces israeli, E. coli, Klebsiella pneumonia, cat scratch disease. Drug reactions: ulcerative erythema multiforme, lichenoid reaction, toxic epidermal necrolysis, epithelioid angiomatosis, deep fungal infections, histoplasma and mucormycosis, neurological manifestations, facial palsy and trigeminal neuralgia, and viral manifestations, cytomegalovirus and molluscum contagiosum. Coming to the treatment of HIV, highly active antiretroviral therapy or HART. The group of drugs in this antiretroviral therapy are nucleoside analog reverse transcriptase inhibitors, pseudobudin and lamivudin, non-nucleoside analog reverse transcriptase inhibitors, nevirapine and delavirdin, protease inhibitors, indinavir and nelfinavir, and NRI inhibitors. What are the modifications of dental treatment for patients affected with HIV? You can give antibacterial mouth rinse prior to any treatment. These patients may have thrombocytopenia, so bleeding is one common manifestation. So as far as possible, avoid a deep block injections, and you can give local infiltrations or intraligamentary injections. Patients presenting with xerostomia, you can give fluoride supplement. Then in oral surgical procedures, one of the complications presented is alveolitis. So if the CD4 cell count is less than 100 cells per millimeter cube, you can give antibiotic prophylaxis. And when the platelet count is less than 20,000, surgery is contraindicated. And it is very important to maintain hemostasis. Periodontal treatment, scaling, root planing and curettage can cause transient bacteremia, so you can give antibacterial mouth rinse, povidone iodine. Then endodontic treatment, meticulous instrumentation should be there, and you have to be careful to avoid passing the instrument beyond the apex. Post-operative flare-up, you can manage with NSAID and antibiotics. Then patients who have presented for orthodontic treatment, non-surgical orthodontic treatment can be performed safely. So these are the oral manifestations and modifications of dental treatment and the treatment for HIV. Thank you.